It's going to be a long process for patients in Ohio, perhaps up to 2 years before a patient would be able to walk out of a dispensary with medicine. How should they be using that time, that interim time?
As a healthcare professional, it's hard for me to give advice as far as legal. My advice to patients often is I would say what I would do. If I were the patient and I had cancer, I would go find a source, whether it be growing it. I would possibly even, if I had the finances, I would encourage patients to literally leave the state to get the medicine if you need it right away, if you have the wherewithal to grow it or you know someone who could grow it. And that's literally saying, I would commit an illegal act, but my health is more important, and I think this law is based on false information. For other patients, in terms of how to prepare, at least recognize, do you have a healthcare professional who will sign the recommendation when it is available? You'll want to find that out. If you don't have one now, go find one who will be willing to do this, who actually will look at the science and say, do no harm, I can give you this that is safe, that I know cannot kill you, I know the side effects are not going to be atrocious. Yeah, I'll sign this recommendation for you to use this medication. Certainly read anything and everything you can on it. The science is there. I certainly recommend Patients Out of Time as a source of information, and on our website you'll find other sources of information. And feeding that information to your healthcare provider to make sure your healthcare provider is more educated. But it's a challenge. I mean, you're medicating sometimes for pain, and patients are willing to go through the pain until they can become legal. But when it's life or death, waiting that time period, that's too big of a price to pay.